Hi, Beverly. I'm Sarah. I'm a nursing student. How are you doing? Good. That's good. The purpose of our conversation today is to prepare you for your discharge this afternoon and make sure you have all the information you need to manage your COPD at home. I have a video to show you that has everything you need to know. Is there any questions before we begin?
No, you're all fine, dear. You're all good.
All right, let's take a look.
Living with COPD. COPD, or chronic obstructive pulmonary disease, is a progressive disease of the lungs that makes breathing difficult. It is characterized by a limitation in airflow and chronic inflammation of the airways. When we breathe in, air travels down our windpipe and into our lungs through airways called bronchi. The bronchi then branch out into smaller tubes called bronchioles, and then into small air sacs called alveoli. Alveoli are normally elastic and inflate and deflate while breathing. The alveoli are surrounded by a network of capillaries that provide the body with oxygen and bring back carbon dioxide to breathe out. In COPD, the airways become thickened, inflamed, and more mucus is produced that can clog the airways. Over time, the alveoli become damaged, making it difficult to breathe and blocking your body's source of oxygen. The most common symptoms that are characteristic of COPD are coughing, mucus production, and shortness of breath with physical exertion. Here's a look at some of the medications you might be prescribed. Long-acting bronchodilators such as formoterol or salmeterol. Short-acting bronchodilators such as albuterol or salbutamol. And corticosteroids such as budesonide or fluticasone. Bronchodilators relax the bronchi and bronchioles, the passageways into the lungs, making it possible to breathe in more air with less resistance. It also helps prevent inflammation by inhibiting the release of inflammation-causing mediators from cells. The long-acting bronchodilator is used for daily management of symptoms and prevention of exacerbation, whereas the short-acting is used for days when extra help is needed. Corticosteroids also relieve inflammation, which helps to minimize the factors contributing to the obstruction of the airways. Ask your healthcare provider to show you how to use your Aero-Chamber, which maximizes the amount of medicine that reaches your lungs compared to just using your inhaler alone. Don't forget to rinse your mouth with water after using your inhaler. There are other treatment options that might interest you. Antioxidants have anti-inflammatory properties and may help relieve mucus. Antibiotics may be prescribed during exacerbations or for long-term therapy to help control microbial infection. Alpha-1 antitrypsin replacement is thought to relieve the decline of lung function brought on by its deficiency in COPD. In order to manage your exacerbations, it's important to make frequent and regular visits to your healthcare provider, who will assess and monitor your COPD and make changes in your treatment if necessary. In addition, you should reduce your exposure to risk factors and maintain your COPD at a stable level by managing your exacerbations. Avoiding these risk factors will help you manage your COPD. Reducing your smoking or exposure to smoke slows the decline in lung function and helps to return your appetite, as smoking is a known appetite suppressant. A healthy diet and maintaining a healthy weight will also help preserve your lung function. Try to avoid irritants in the air like dust and pollution, particularly in farm-like areas. Protect yourself from getting infections by keeping up to date on all your vaccinations, including annual flu vaccines. The healthcare team should collaborate with you and your family to create a care plan that suits you. The goal of management is to decrease further exacerbation of COPD condition through medical intervention and a change in lifestyle. An exercise plan with a respiratory therapist may be implemented if you have the physical abilities to do so. The key goal is to maintain muscle strength and exercise of lung strength through pulmonary rehabilitation. Management of proper inhaler techniques is important for proper drug delivery. Many patients who are unable to maintain stable COPD have errors in their inhaler technique. Vitamin D and calcium supplements are encouraged as medication with corticosteroids leads to osteoporosis. Learn to work around your COPD by changing your lifestyle. For day-to-day activities, it is best to plan out the day and it is important to understand things may take more time than it used to. Breathing techniques will help you remain calm when you're breathless. Pursed-lipped breathing and diaphragmatic breathing is your best recommendation. Your family can help too. Families that volunteer to care for patients with COPD are vital to enabling effective therapy. As your COPD progresses, the range of activities you can do will slowly be limited. Being provided care from family members will help with not only the physical needs, but also mental needs, and will greatly enhance your quality of life.
So Beverly, did you find that video helpful?
Yes, very good.
Good. Is there anything that you would like me to clarify?
Can we go over the puffers? My respiratory therapist went over it, but kind of can't remember it that much.
Absolutely. Do you know what? Let's do it together and I can walk you through all the steps.
That's perfect. Yeah.
So Beverly, do you know what you have in front of you here?
Let me see. This is my Aero-Chamber
Yeah.
and my 2 puffers.
Great. Do you know which one is your bronchodilator?
This one?
Yeah.
Yeah.
And then what's this one?
I can't remember.
This one is your steroid.
Oh, right, of course, yes.
So why don't you go ahead and take your Aero-Chamber out?
Okay. Here we go.
Perfect. And you can go ahead and take the caps off the mouthpiece of your Aero-Chamber and the mouthpiece on your inhaler. Perfect. And now you're going to put the inhaler in the Aero-Chamber, and you want to make sure that this airflow vent is on the top.
This thing right here?
Yes, perfect. So one thing that you want to do is you want to check to make sure that when your mouth is on it that you have a good seal. So one way to do that is you put it in your mouth, breathe in and out a few times, and you'll see the flap in the vent move. So let's do that. Did you see it move?
Mm-hmm.
Wonderful. So I'm going to go through the next few steps and then I'll let you do it. So what you're going to do is you'll put the Aero-Chamber in your mouth, take a big breath out, and then when you go to inhale, you're going to squeeze your puffer, big breath in, and hold it for 5 to 10 seconds. And then while the Aero-Chamber is still in your mouth, you're going to breathe normally 2 or 3 times.
Okay.
And then you'll take it out. So why don't you show me? Yeah.
Okay.
So you put it in your mouth, big breath out, squeeze your puffer, big breath in, hold it for 5 to 10 seconds, and then breathe normally 2 to 3 times. Great. So you want to make sure you follow the instructions on your puffers. So it says to take one of your bronchodilator and one of your steroid. So let's switch them out and take a puff of your steroid.
Okay.
So this time I'm going to let you do the full thing on your own without any prompts, and I'll make sure you're doing it right.
So we would put my steroid.
Yeah, so we switch them out and we'll use the steroid puffer now.
Exhale out first.
Yeah, so check and make sure you have a good seal, and then exhale into the chamber first. That was perfect. And if you ever get confused or forget some of the steps at home, there are some directions on the box.
Oh, I see. Good.
Did you have any questions before I go?
Yes. Is this dishwasher friendly?
It is dishwasher friendly, Beverly.